Hi, this is Charles and I'm here to run through a quick demo of NeoEHR with you and to show you the various ways in which Neo can transform your hospital operations. Various users have their own modules on Neo. A user's job title, as set up by admin in settings, determines the modules a user can access. Let's begin with our typical patient journey from front desk. Once logged in, your front desk team will be able to view a list of patients with appointments in your various clinics. Using options on this screen, you can view a patient's insurance details, add a new patient and create appointments. You can also create invoices and manage invoice payments. The patient shows up on the nursing screen once their insurance plan is verified, or alternatively, once they've had their consultation invoice paid or set as for service on credit. To enter clinical data, the nurse simply taps on the card to gain access to the All Input screen for outpatient nurses. On this screen, the nurse is able to enter vital signs and is able to optionally specify the measurement site of relevant signs. The nurse is also able to record physical examination findings, as well as record procedures and other clinical notes. Clinicians can view nurses' and doctors' notes in the patient encounter timeline, and notes can be reviewed and saved to nursing records. Once the nurse has added vital signs, the patient is automatically moved to a waiting doctor and assigned to a doctor. Nurses and doctors are able to reassign patients to another doctor. The doctor can review recent clinical entries on the patient encounter timeline. To record presenting complaints, the doctor can type notes or use the suggestions. Once the doctor has searched and selected a symptom, they can use the Socrates menu to describe the symptom. The platform provides symptom-specific site, character and association findings for selected symptoms. The doctor can also search or type to enter clinical and differential diagnoses, use selections to request clinical investigations. The search items and suggestions are based on SNOMED, supporting easier clinical analysis and the platform's automated reporting function. NeoEHR also handles synonyms of clinical terms, improving the robustness of your records. The doctor can also search or type in the prescriptions panel, using our database of over 6,000 drugs to find medication and to enter the dosage. Once the doctor has finished entering their notes, they can review the automatically generated notes and edit the notes, and once done, save them. The patient status is then updated to "Seen Doctor." Once the doctor prescribes medication to a patient, the prescription is automatically available in the pharmacy module. The pharmacy team can see all the patients that have had prescriptions requested or are in process, and can invoice and dispense prescriptions. Pharmacists can also view medication in inventory and add new products or quantities to inventory. The laboratory team can see all the patients that have had investigations requested, or for whom lab tests are being processed. Laboratory staff are also able to record samples taken, as well as process and record test results. The Finance module is accessible by the hospital's chief executive, the head of finance and finance personnel. Once invoices and payments are handled on the EHR, users are able to view patient transaction summaries and total invoices, payments and amounts outstanding for the patients seen in the hospital in the chosen period. They can also view a patient's transaction statement with the hospital over a chosen period. Depending on the user, the Finance module may be a part of the dashboard. On the dashboard, users are able to generate various automated reports by choosing the report and the time interval. The user may go ahead to edit or download the report ahead of submitting it. And that is it. We have successfully gone through our typical patient journey from front desk and seen how various users get to interact with NeoEHR. Feel free to visit these links displayed to view even more resources that you can find helpful, or reach out to our support team using the link displayed on your screen.